Doctors of Reddit, what was your dumbest patient experience? RN here, I see some crazy stuff. But one thing that stands out was the time I was admitting a guy to the hospital. I cannot really remember what for, but he was about 400 pounds. Diabetic, heart disease, you name it. Anyhow, I am at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he is thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "Nah, no water, he's allergic to water." Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, we're planning to stay at the hospital with him. You cannot make this shit up. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house. So she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake and she said she drinks a 32 ounces soda every day. I ask her if it's regular or diet and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I had a patient who was a completely non-compliant diabetic smoker, morbidly, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. 70-year-old female tripped and fell 2 days ago. She came out with hip pain but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative no. You are wrong, just stop it. I work for an optometrist and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he is nearsighted and basically cannot see clearly past 5 in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the mom and she spazzed out on the doctor, saying that her son does not need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he is only trying to help them but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all, because he could not see the board in his classes and needs glasses. Any variation of this, which I get all the freaking time. Me: so how are things going with your diabetes? Them: I do not have diabetes. Me: then why are you talking metformin, Victoza, whatever? Them: I used to have diabetes, then replaced diabetes with hypertension, antihypertensives, etc. Or when I ask them what medical diagnosis they have and they say none while taking a ton of meds. Or when they misname a body part, prostrate, tendon, uterus, to name a few. Me: is there any chance you could be pregnant? Patient: definitely not. Me: are you sexually active? Patient: yes. Me: what is your preferred method of birth control? Patient: nothing. Me: SMH. Not a doctor, but I am a nurse who worked in the OR at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine. Who is grilling the anesthesiologist about every drug we were going to use in surgery because he does not like putting chemicals in his body. Got to stick with that organic, fair trade, non-GMO cocaine. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children, thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story from a colleague: a patient comes into AE with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." I've got 2 stories that stick out in my mind. The first is the mother of a toddler who came into eMERG. The kid had cruddy green bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mom was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But Mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big Olay button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. Side note: if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. Patient had a hard time getting pregnant, finally conceived but miscarried. Patient has ADC so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone, and this was after an hour of the docs saying, "We do not know why you have these constant high levels of HCG in your blood and we are worried." Had a young woman with recurring UTIs that began after a recent partner and with no STDs. Went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not tea jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh, I have 2 good ones that come to mind. Clinical pharmacist here BTW with one story in the and one in the pharmacy. One physician told me this one 16-year-old boy presented to the with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we could not refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. Edit forgot to include the teenager's reasoning. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that puff machine gives you glaucoma and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma does not have any outward symptoms before you start going blind. This dipshit just told me he has a very strong familial disposition to glaucoma, and refused to be tested for it. Edit spelling. Edit to woo that took off. Also, puff isn't he that bad guys. Try contacts. Your eyes stop fighting back pretty quick. The puff is a lot better than the old machine. It just hit you on the eyeball with a little ball on a lever. Another edit. I also have plenty of patients that do not understand family history. I interview patients directly so we do not have any real paperwork, and too many people cannot answer simple questions. Do you or any of your direct family members have diabetes? Yes, yourself or your family. Alternately, if yes to family members, they start listing their spouse's family or stepchildren, not how genetic disposition works, or after getting no answers to diabetes, hypertension, glaucoma, thyroid problem, heart problems, etc. I ask if they take any medications. Yeah, atorvastatin, thiazide, metformin, and low-dose aspirin. Oh, so you have everything I asked about. Check. Want some more? Way too many people do not understand presbyopia. As you age, your lens hardens and cannot focus up close anymore. Of course, when this is explained, I get a lot of people who believe they are way too young for bifocals. No, 60 is not too young for bifocals. Why does not the doctor have to wear bifocals? He does. He is wearing progressives. You do not see the line. Or after trying to get used to multifocal lenses for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again when they cannot read with the "I never needed bifocals before. Why cannot you just make me regular glasses?" Regular glasses always worked just fine. Yeah, you used to be 20. Also, you came to see us because you cannot read with your regular glasses. In the same vein, these same people complaining about they own insurance to me, because progressives are expensive. A line bifocal is covered entirely. Progressives cost a lot. I cannot have lines in my glasses like an old person. Then you want progressives. This easily triples the bill. Why are you so expensive? I need to be able to see. Yeah, you need a bifocal. You do not need a progressive. You want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk to his insurance agent about him needing medically necessary progressives. A progressive lens is never medically necessary. Stop being cheap. And listen to what I say. I am not a salesman. I am a medical professional. Stop acting like you know better than me. 80Y. Oh. Patient who was declining with multiple diagnoses and about 3D cubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all. BTW. At some point you kind of have to stop being polite and just tell patients' family members bluntly that you do not have time for this shit and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. RN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He is admitted to the floor and gets 4 antibiotics. What? Consider subscribing if you enjoyed this video and if you want to see more of Reddit Universe.